Good afternoon. This is Yohei Takada from FuncPhysio Physical Therapy in New York. Today we have a special interview with Dr. Tokiwa from Columbia Medical Center in New York City. Thank you for coming, Dr. Tokiwa.
Thank you for having me.
Dr. Tokiwa is an OBGYN doctor, seeing her patient every day in this pandemic situation in New York City. And the reason we asked Dr. Tokiwa to join this meeting is that FuncPhysio provide many aspects of service related to pregnancy. And we get a question related to COVID-19 from our patient who is currently pregnant or who is looking for having another family member. So I think that this is a great opportunity to have Dr. Tokiwa to answer these questions. And also, let me introduce Nidhi Sharma. Hi, Nidhi.
Hi, Yohei.
Yeah, Nidhi is a physical therapist at FuncPhysio who has both certification in women's clinical specialist and orthopedic clinical specialist. We are so lucky to have her with us on our team member. And on the top of that, this is just coincidence, Nidhi herself is in the 26, am I correct?
23.
23 weeks of pregnancy. So herself is going through this difficult time with her own pregnancy. So I thought Nidhi is the best person to ask a lot of questions related to this COVID to Dr. Tokiwa. Thank you again, both of you, to join this interview. Especially Dr. Tokiwa, I think it's very, very busy time of your career right now. So thank you very much.
Thank you.
Okay.
Thanks, Yohei. Thanks for having us.
Let's start.
Mm-hmm.
Okay. We have a list of questions. Nidhi, can you start from first question and go through it?
Yep. Thank you, Dr. Tokiwa, for taking out the time. Really appreciate it.
Thank you for having me. I think it's a great opportunity for me too. Yeah.
Oh, thank you.
Mm-hmm.
So do you think as pregnant women, we are more prone to getting infected from the COVID-19? Or if we do get infected, are we more likely to have more severe disease?
So because COVID-19 is a very new virus and there is so many things we don't know yet, but as far as we've seen from few studies, it does positive for COVID, and also if they are positive, the fraction of patients who become severe symptom seem to be same as patients who are not pregnant.
So we don't seem to be extra prone. Okay.
Extra prone, right.
And if we do get sick, our symptoms likely will be similar to other people? But given that I know that we had said flu can be dangerous for pregnant women, flu is like this fever with flu. Does it depend which trimester we are in? Which trimester might be more likely to create problems earlier or later?
Yeah, so that's also a very hard to say at this point because we started know about this virus since like December or January. So those patients we found out being positive in the first trimester, like haven't had baby yet, right? So but we in working in Colombia, we have seen patients who had positive result and who delivered baby. It doesn't really, we can't really say like what trimester caused what kind of symptom. If you get this early, then can it be like tetragenic? We don't know yet. But like you said, as a flu, we do know that if you get flu during the pregnancy, you tend to cause pneumonia. So which is why we recommend the flu vaccine for all pregnant women the family member who has a pregnant woman. But I think the fraction of patients who get severe symptom like pneumonia, it's same as the non-pregnant patient.
Okay, that's good to know. And I don't know, maybe just for Colombia, but are all hospitals in New York testing pregnant women before we come in for delivery?
I can't say all hospitals, but I think we are leaning towards that way. And then we in Colombia, we started that from March 22nd, I believe. That is, it's not all the pregnant patients, but all the pregnant patients who are going to be admitted for the delivery purpose. So for the delivery purpose, yes, we test everyone.
And if somebody tests positive, then can they still go through the delivery in the hospital, or they isolated? They can.
Usually, like when you have labor, when you think you broke your water, you go to labor and delivery triage. There you get evaluated and being tested, and then the test takes still a few hours to come back. So, but if of course you need to be admitted because of the labor and delivery component, yes, you'll be admitted. And then the test comes back sometime, hopefully before you have baby. But if your labor progresses sooner, then you might know the result after you have baby. But it doesn't. It just changes how a medical personnel protect ourselves, but it doesn't change your labor management.
Oh, it doesn't change if we get admitted, or how long do we get to stay in the hospital, or any of that?
It doesn't change. As long as you're doing well, you're asymptomatic, it doesn't change.
Okay, all right. And is the labor and delivery different these days in terms of how much time we get to labor, or how much? Are you limiting that if somebody doesn't progress this fast, will induce or will try to get this done within these many hours, because you don't want people in the hospital for too long?
So no, in terms of labor management, no, we don't change. We don't change. Yeah, we don't change. Even your result is negative or positive or unknown, we don't change. But after you give birth, and also, we are now allowing one partner to be present in the labor and delivery. So so when the patient's in labor while you're delivering, and immediately after postpartum, that's usually 2 to 3 hours after you have baby. And then when patient goes to the postpartum floor, the partner has to go home. So on the postpartum floor, you'll be with your baby by yourself. So in terms of your question, on the labor, how long you can labor, or how long you take till delivery, it doesn't change. Right? But postpartum, if you are recovering well, if your baby is recovering well, and if you want to, you can go home sooner than usual. So usually before the COVID, the pregnant women go home after staying 2 nights after delivery. And if you have a C-section, you stay 3 nights after C-section. As long as you're doing well, baby's doing well, people tend to go home 1 night after or 2 nights after each.
And that's patient's choice. That's not a hospital policy.
That's not a hospital choice. Yeah, of course, if your mom doesn't feel ready, or sometimes baby's not ready to go home yet, after 1 night, then of course you stay longer.
And are all babies tested, even if the mom tested negative?
So I think what they are doing in our pediatrics in Colombia is when mom is tested positive, then baby gets tested.
But if the mom and dad didn't test positive, then baby is not tested.
Baby is not tested.
Okay.
Right. Yeah. But then also, in terms of where baby is going to be, there might be a slightly difference from hospital to hospital. But in Colombia, if mom wants to be with baby, then baby stays with mom in the same room. And then, but once baby stays in mom's room, then even if mom wants to get some sleep or get some rest, baby cannot go to nursery. Baby always stays with mom, so that baby is not exposing to the other people.
That makes sense. And how many number of nurses and doctors? Everyone has PPE, obviously, going into the delivery and labor room. Are they restricting how many medical personnel go into the room?
So we try as minimum. So usually one nurse is assigned to the one patient. That's from the from even
That's
even before. But also, like, we want to make sure the patient is safe, baby is safe. So sometimes, yes, if the labor or delivery takes more people, more providers, and then of course we may have to go into the room, but then we of course use the proper PPEs.
Okay.
Yeah.
And if mom does test positive, can she still breastfeed? Is that advisable medically?
Yes,
Or
it is always advisable. Having COVID is not a contraindication to breastfeeding. So also, as far as we know, I think the research showed that if mom has a COVID at some point of the pregnancy, mom has some antibodies, and that's being transferred to the baby through the placenta. But also some of the antibodies go to the breast milk too.
So it might actually help the baby.
It may actually help the baby, yeah.
Good. So if the mom tests positive and the baby tests negative, the baby can still stay in mom's room and still breastfeed, or can only breastfeed, not stay in the room because the mom is positive?
No, when even mom is positive and the baby is negative, they are always together.
They're still always together.
They are still always together in the room, and the mom can breastfeed, should breastfeed.
Okay, so that there's not a concern that mom is going to infect the baby, because I read some news about babies being isolated from moms who are positive.
So I think that's a lot of part we don't know yet. So I think that's the part of it. There might be slightly different protocols from hospital to hospital.
But in New York, in
my hospital, yeah, they are being together, unless baby has some kind of different reason that has to go to NICU or be evaluated. But as long as again both of them are asymptomatic, as long as they're doing well, then they stay together.
And if the mom has symptoms, can she still stay with the baby?
So if mom has symptoms, then that depends on how much of the treatment mom needs.
Got it.
If mom how severe. If mom is not well enough to take care of baby, of course they are not being together.
Okay.
Yeah.
Okay. So it's mostly about just taking care. We're not concerned about infecting the baby.
Yeah. I think I want to be clear. I think we are concerned, but we are concerned, but we just don't know that. Yeah, we don't know yet.
Yeah, isolating is going to help. Yeah.
Right.
Yeah. Exactly. That makes sense. And how can moms protect themselves coming into the hospital, before we get to our OBGYNs, not get infected in the hospital?
I think that's everyone's concerns, and I think that is a good point. So that's also why we decrease the amount of patients who come to the outpatient office for the prenatal care, so that not a lot of people waiting in the waiting area. When you come in, you go to the exam room right away, so you're not around a lot of people. The same thing goes to the hospital. When you're going to the labor and delivery, I think the good thing about the especially New York is already most of the rooms are made individualized, private rooms. Labor and delivery is private room. Triage may be different from hospital, but at least in hospital, it's private rooms. So once you get into a room, it's not the airborne. So as far as we know, it's a droplet and contact precaution. So with taking the proper precautions, we shouldn't be transmitting to one person to the other. So that's why you go to the hospital just wearing a mask. And then you don't wait too long time to get into the triage. And then when you get in the triage, that's isolated by medical personnel taking the right standard precaution. We're minimizing passing this virus to the medical personnel to the patient. And then when you get admitted, also that's a labor and delivery individualized room, private room. So it's very unlikely you're gonna get infected from like patient to patient.
And that you said can differ from hospital to hospital, but this is Columbia's protocol.
Protocol, right? Yeah, but I'm pretty sure in New York, most of labor and delivery is usually private rooms. Only the part may be different is just the triage rooms.
Okay.
Yeah.
Okay.
Triage can be separated like by just the curtain.
Okay.
Yeah.
And that everyone will go to triage first because they need to get tested.
They need to be evaluated if they really need to be admitted, or and also to get tested. But if you but let's say if you're scheduled for C-section or scheduled for induction, then you don't even need to go to the triage area because you'll be admitted. So you just go to the labor and delivery room straight.
Oh, okay. So that would be different.
That would be different, yeah.
And a lot of women these days are considering not going to the hospital because of the concern of getting infected.
Mm-hmm.
Do you have any recommendations about, stay at home and hire a midwife or go to a birthing center or versus going to a hospital?
So I think, I see that those kind of posts on the Facebook too. But so, delivering with midwife as delivering, doing home birth is not alternative of the way to deliver baby. Those are meant to be, for women who want to have natural birth. So those women, if you plan that way from the beginning, I have no opinion, but because you're worried that you're gonna get infected in the hospital, so that's why you want to have a midwife or a home birth, and I think that's a very poor choice because hospitals are taking precautions of like I just explained about, and then like I said, the home birth is it's just like a different, you're trying to have a different kind of birth experience than the hospital provides.
You should do it for different reasons.
Right. You should do it for the different reason. And also, having home birth has a different risk. So that's going to be a whole different conversation other than this COVID. Yeah, yes. This COVID. So if you had planned from the beginning, I think that's okay.
I was actually thinking earlier that I would go to a birthing center, but now I switched to a hospital, specifically thinking that if I was infected or my baby was infected, I would want the baby to have a NICU available. I would if something was too bad was to happen, this is the time to want a hospital. Actually,
right. I think that's a good point. Actually, yeah. One of the reasons I say the compass is different situation is because there's a reason that the hospital is the place to have baby because during the labor, not related to COVID, not related to anything. In labor and delivery, the 1 minute can make a big difference sometimes. And when that something happens, then you can quickly act on it. That's the benefit of being in hospital. In a home birth, that would be very difficult.
That's true. If we do get symptoms, I'm only 23 weeks, but if somebody was even later in the pregnancy, should we contact our OBGYN or should we contact our PCPs?
If you get symptoms, if you're concerned about if you got COVID, you can always contact your OBGYN because the OBGYN should know how to get your patient being tested.
Okay. Yeah. And if I am told, because a lot of times that's what we're told, that just watch your symptoms and rest at home. And if it gets worse, then if we are resting at home and just watching our symptoms, are we okay to take the medications that other people are taking? I know that some medications are not okay. We cannot take Advil, but we can take Tylenol, I guess.
Right. Yeah. So if you have fever or generalized body aches, like muscle ache, joint aches, headache, you can take Tylenol, and that's safe for the pregnancy and also for the symptomatic relief for the COVID, that's safe. And also some people have sore throat, some people have congestion, then you can take Robitussin or Benadryl or Claritin. They are all safe for pregnant women.
Okay. And when should we be concerned about how high our fever is? Like 100 or whatever number is the number of the fever that we should be concerned at?
So the number of fever doesn't, we say, I think now it's 100 Fahrenheit. But how high the fever, it doesn't really correlate your symptom. What you should be more concerned about is so generally, yes, fever, but also chest pain or shortness breath, especially shortness breath. When you become third trimester, yes, everyone has shortness breath. Right? So, but it's more concerning when you're talking like this, then you can't talk whole sentence without taking a breath.
Got it.
That's the type of the shortness breath that you should get concerned about. Or chest pain. Yes, it's common. When baby pushes up in the latent pregnancy, you have pain, constant pain in between your ribs or on the right side and left side. But it's more when you take a deep breath.
If you have chest pain.
You have a chest pain. Or even when you're talking normally, when you're not doing anything, you're not exhausting yourself, you have chest pain. That's more concerning.
Okay, that's very good to know.
Yeah.
And if I'm pregnant, and we know that this isn't going anywhere. Like the infection is gonna stay. It's gonna get better, but it's gonna stay. And I have to go back to work, or somebody who has to work now, being in other professions. What can we do, or what should we do especially to protect ourselves?
Yeah. So, of course, if you have a choice to work remotely, that's good. But if you don't have the choice, you really have to take the precautions, like wearing mask, washing your hands, and taking the social distance, 6 feet apart. And also, even if you feel sick, the sick can be fever, just having sore throat, can be diarrhea. Any signs of infections, if you're not sure, then I think it's better to stay home and then talk to your OBGYN or your primary care doctor and then see what they say before you go back to work.
Okay. All right. And any other advice you have for us?
Yeah, so again, I didn't say this, but so if you think you might have COVID symptom, or especially anything, any symptom, if you have any health concerns, it's better to call before you physically go, because I think that's take on point. I usually say to my patients, if you're not dying, or if there is dying concerns, you shouldn't just go to the hospital. And if of course you feel like you're dying, then you should go. But otherwise, you can always take your time and call somebody before you make any actions, so that can protect you, and then that can protect your family, and then that can protect some others.
Okay. All right. Yeah. Sounds good. Thank you.
Yeah, of course.
Thank you very much. I have one question actually.
Yeah.
Is that okay? Let's say if your partner is infected or has a symptom of COVID-19, not just you, but your partner, what should you do in terms of preventing infection from your partner?
Yeah. If you have a choice to live separately, do that. Okay, so either you move out or you send your partner to friend's house which hasn't been used or something. So then you can just take food to the apartment or something. But if you don't have the choice, and then just do your best to quarantine your partner to one room and with separate bathroom, and then you just hang the food, food or whatever your partner needs at the door, and then without contact. Yeah. Okay. So far, I think we do know this virus is very contagious. Right. So if you live in the same apartment, it's very hard to prevent.
So the best advice is basically try to live separately at that point.
Separately, yeah, I think so, yeah.
And that's the same thing, Dr. Tokiwa, would happen if the woman and the husband or wife got tested going into the hospital, and the person who is coming with the woman was positive, they would not let them in.
So
labor.
yeah, that's right. So for labor. So we as a labor and delivery, we are not testing partner, but it's possible. Yes, partner may have been tested before. If partner had a symptom before, and then if partner is positive, then we are not allowing partner to come in. But as a labor and delivery, if partner has symptom, partner is not allowed to come in. But we are not testing. We just don't have the capacity to test the partners. Yeah. So the partners are already getting the symptom screening and also twice a day temperature.
Okay. Yeah. All right. And are women, this is a funny question, are women wearing masks during labor?
Yeah,
like
they have to. And then it's so hard. It's so hard. They have to push wearing masks. Yeah. The only time you can take off masks is when you want to drink or eat something.
And same for the partner. I mean, partner is
same for the partner. Yeah. Yeah.
Okay.
It's very hard. I'm sorry.
That's something we should practice at home.
That's true. You have to get used to wearing masks.
Okay. All right. You have any other question, Yuri?
No, I'm good.
Yeah, I'm good too. Thank you. This was very helpful.
Yeah, was it helpful, really?
Yes, very helpful.
I hope so, yeah.
Thank you.
Yeah, but the things may change, the protocol changes all the times. Yeah, so if you can be clear about, this was taken April 18th, 2020, because it may change May 1st. Okay.
Yes.
I didn't know you're pregnant, Nidhi. Congratulations.
Thank you. Yeah.
When are you due?
August 14th.
August, yeah. Hopefully in August
things will be better.
Things will be better. Yeah.
Yeah, I'm hoping so.
Yeah.
Hi. So I am offering telehealth sessions for anyone who is pregnant. I know you're pregnant, your pregnancy is still progressing as usual. You still have to do all the work. There's more childcare needs at home. So if you have any back pain, neck pain, leaking, pelvic pain, any of the weakness from the pregnancy and symptoms, you don't have to ignore them. There is definitely care available still. And you can do a lot of exercises and a lot of things yourself, which we can guide you through a webcam. So if you are suffering from any of the problems with pregnancy, definitely reach out to us. We can help.
I hope this information is helpful to you and your family. Please stay safe, and I wish you have a great healthy new babies. If you have any question and comment, please send us a message. Thank you.